Hello and welcome. My name is Caleb Tabler. I'm an exercise physiologist here in cardiac rehab at the Heart Institute. Today I'll be talking to you about the basics of exercise and how to implement an exercise routine safely and effectively to meet your lifestyle and health needs. Today we'll be talking about some basics of how much to exercise, how often, and what activities could best suit you and your lifestyle. The first thing I want to emphasize is starting slow. If you haven't been active in a while, it's important to ease into exercise. Jumping into an intense exercise routine too quickly can lead to injuries or cause you to get discouraged. Instead, begin with shorter sessions, 10 to 15 minutes of light exercise, for example, things like walking, cycling, or swimming. As your endurance increases over time, you can start to increase the duration and intensity of your exercise. But most importantly, listen to your body. If you feel pain or discomfort, slow down, stop, and rest. It's not about doing everything at once. It's about being consistent and gradually progressing. Next, let's talk about choosing exercises you enjoy. Exercise doesn't have to be something you dread. It should be something you look forward to. And one of the best ways to make it a long-term habit is to choose activities you truly enjoy. Some examples could be walking, swimming, biking, dancing, or even gardening. The key is finding something that feels good for you and fits into your daily lifestyle. You might even want to try a few different activities until you find what feels best. The more you enjoy it, the more likely you'll stick with it in the long run. Now let's talk about how much exercise is recommended. The goal is to aim for at least 150 minutes of moderate intensity exercise per week. That might sound like a lot, but when you break it down, it's only 30 minutes per day, 5 days per week. Moderate intensity exercise means you're working hard enough to raise your heart rate and break a sweat, but you should still be able to talk comfortably. An example would be brisk walking, cycling at a moderate pace. If you can, aim for 30 minutes of exercise. If not, that's perfectly fine. You can break it up into shorter segments throughout the day, like 3 sessions of 10 minutes per session. The goal is consistency. Even on days you can't commit to a full 30 minutes, try to move for at least 10 minutes. Over time, that adds up, and you'll begin to notice improvements in your overall fitness. Next, I'll be talking about strength training. In addition to aerobic exercise, strength training is a crucial part of a balanced fitness routine. Aim to include strength training 2 to 3 times per week. This doesn't have to be with heavy weights. You can use your own body weight, resistance bands, or even light dumbbells. Strength training is important because it helps build and maintain muscle, which in turn supports your bones and joints. It also improves balance and flexibility, and can even help manage chronic conditions like arthritis and diabetes. Some simple strength exercises to start with would include body weight squats, lunges, push-ups, or resistance band exercises. Start with a few repetitions and slowly and gradually increase as you get stronger. Finally, let's talk about stretching. Stretching helps improve flexibility, reduce muscle tension, and can prevent injury. After your exercise session, it's a good idea to stretch your muscles that you just worked. Hold each stretch for about 15 to 30 seconds without bouncing. Focus on major muscle groups like hamstrings, quads, calves, shoulders, and back. You can also stretch before exercise, but make sure to warm up with light cardio like walking or cycling before you stretch. The key to stretching is not to force your body into a position, but to stretch gently to a point of mild discomfort and breathe deeply throughout the stretch. To wrap up, remember that starting slow and building up gradually is key to a safe and sustainable exercise routine. Find activities you enjoy, aim for 150 minutes of moderate exercise each week, add strength training 2 to 3 times per week, and don't forget about stretching to improve your flexibility and reduce the risk of injury. Be patient with yourself, celebrate small successes, and most importantly, keep moving. Exercise can help you feel better physically and mentally, and it's never too late to start. If you have any questions or need help tailoring an exercise routine, don't be afraid to ask. We are here to help. One of the most frequent questions we receive is, how do I know I'm exercising at a moderate intensity level? One way to determine this is doing the talk test. During exercise, if you can carry a conversation or sing a light song, you're probably working hard enough at a moderate intensity level. Another way to do this is to use a target heart rate zone. If you're curious about calculating this zone for you, speak to one of the Cardiovascular Health and Wellness Clinic staff and they can help. Some additional resources that are available to you through the Cardiovascular Health and Wellness Clinic is you could consider a 2-month Wellness for Life program through the YMCA. This is at no cost to you. If you have any unanswered questions at that time, you can even consider an exercise physiology consult here at the Heart Institute.